In this morning's Health Watch, how did Congresswoman Giffords survive a gunshot wound to the brain? Doctors say more than 90% of such injuries are fatal. More than 2/3 of the victims die before receiving hospital care. So here to explain how Congresswoman Giffords seemingly beat the odds is medical correspondent Dr. Jennifer Ashton. Jen, good to have you with us here on site this morning. First of all, how is she doing this morning?
She's still in critical condition, Erica. There were no events overnight. She is heavily sedated with a breathing tube in place on a ventilator to help support her breathing. We also can't forget there are 9 other shooting patients here in the hospital. Good news yesterday, they were all transferred from the intensive care unit, 3 downgraded to serious condition, 6 in fair condition.
That is good news indeed. So now that we know how everyone is doing, and as we focus on this wound, you hear that Congresswoman Giffords took a gunshot wound to the head, and you think, how does she survive?
Right. First, let's talk about the surgery that was done yesterday, Erica, because that is critical to her survival. It's called a decompressive craniotomy. This is a model of the skull. This is not exactly what was done with Congresswoman Giffords, but very similar. You'll see here that the hair gets shaved, the scalp gets flapped backwards, and a large portion of the cranium skull bone is drilled away. This portion remains in a refrigerator for up to potentially 2 to 3 months.
Wow.
And this area here is left open so that the brain can swell and not impair other parts of the brain.
And that's critical, the swelling and having the place to swell.
Absolutely.
And now we're learning that the bullet came in the back of her head, and then exited through the front and happened on the left side. How important are those things, that it was the back of the head and also the side?
Critically important. So if you look at the brain, and this is a cross section of it, what we know is that the bullet went through the rear left portion of the brain and exited through the front left portion of the brain. If you look inside, you can see here, Erica, that these critical structures, which tend to be located deeper and more centrally in the brain, were miraculously spared, as were some major blood vessels that also are in the midline. And the bullet did not cross from the left to the right side of the brain, also very important.
The left side of the brain and functions that are controlled there, which could potentially be impaired. Give us an idea of what she may be facing.
Basically, it's the speech center, and we know that the left side of the brain controls the right side of the body, so interpreting speech and being able to speak all potentially could be affected by any type of injury to the left side of the brain. That's why, Erica, it's so encouraging to the doctors that when she's asked to perform a simple command like show me 2 fingers, she's able to show 2 fingers. It will be important to know whether she's raising those fingers on the right side of her body or the left side.
And we just heard from her communications director, CJ Healy. She was able to hold up those 2 fingers tomorrow.
Right.
The recovery, of course, is a long one, much to come, but it makes a lot more sense to have you break it down like this, Jen.
Absolutely,
Thanks.
sure.